got the call that the owners were on their way here with a 2-day-old miniature donkey foal that had a severe flexural limb deformity in the hind limb. When they arrived, we took her into radiology, got some radiographs, and assessed the extent of the deformity, and then discussed the options with them. They elected to attempt a amputation and placement of a prosthesis. When they showed some interest in that, we got on the phone with a representative from Hanger Prosthetics, Billy Fletcher, and he was very excited and enthusiastic to assist from the get-go. And so we were really thrilled to hear that, and that's the same company that has been associated with the dolphin tail, which you're probably familiar with. And so he came down actually the following morning and met with us, and he felt like he could work with us, and we could develop a prosthetic for her hind limb.
We received a phone call from Dr. Liz York at Auburn, and she just asked us if we would be willing to participate in Emma's rehab. And we're always looking for a challenge and looking for an opportunity for a case that maybe would provide some inspiration to our patients as well, to our human patients. And we were able to definitely see that in Emma when we came out and looked at her the first time.
We have transitioned her from the cast that she originally had on or after the amputation into her first prosthesis. And certainly it has been a group effort, certainly on behalf of the veterinarians and technicians and students here at the college, as well as with the help of Billy Fletcher with Hanger Orthopedic Group in getting the wonderful prosthesis designed for the limb. And she absolutely loved it from the get-go. She did very well in it, and it was a very impressive prosthetic.
We started out the day of surgery coming over and assisting in putting on a post-op prosthesis, so to speak. It was a cast with a prosthetic foot attached that she could use for some partial weight bearing. It turned out to be full weight bearing over the first couple days. And then after 2 to 3 days, we made a finished prosthesis that we could put on her and have her go ahead and be using. And that came up above what would be the ankle joint on the horse, or the hock joint. And in doing so, we're able to get her up and running. And then over time, she has grown, as we've discussed, and the growth is required that we provide a socket a little higher or a little lower. And so we've reduced the height of the overall prosthesis as far as the amount that it goes up on her stump or her residual limb. And then over time also lengthened the height of the foot, so that as she's grown, we've been able to keep her level and keep her up and running.
Next, we're still working to ensure that the stump completely heals. Once we get to that point, then certainly I'm going to take a little sigh of relief once we get to that point, but there's nothing that looks like we're not going to get there at this point. It's going quite well. And then as she continues to grow, and she is growing at a quite rapid rate, Billy will work with us in incorporating newer prosthetics as she kind of grows out of the other ones. It's been a very unique case. It's been a wonderful case. I've learned a tremendous amount from this case, and that's why we're here. That's why we do what we do. The ability to for a prosthetic limb to be an option in horses is something that's pretty exciting.
This case means a lot to me. I did a residency at a children's hospital in Massachusetts, and so I was used to seeing congenital cases on a daily basis. This has been inspirational for me to be able to see and be a part of. I think it's also going to be great for our patients to see, especially with the fact that she's dealing with some wound healing issues. We have patients that have, for instance, dysvascular complications associated with diabetes and other diagnoses as well that tend to have these type of problems with wound healing. So it's great for them to see her situation, see her get back up and running and doing what she wants to do, and can kind of be an inspiration to those human patients as well.